Hello everyone and a very warm welcome to our ECIST Bitesize podcast. My name is Helen Krysinski and I'm Improvement Manager with the Emergency Care Improvement Support Team. It's a great pleasure today to welcome the team from St George's Hospital, London, and they are going to talk through their achievements in breaking down silos and barriers, the cross-divisional working to improve patient safety, quality and experience. So with no further ado, I'd like to introduce Matt.
I'm Matt Ayres, General Manager for the Emergency Department, St George's.
And Tori.
Hi, I'm Tori Cooper, Head of Nursing for the Emergency Department at St George's.
And Paul.
Hi, I'm Paul Holmes. I'm the Clinical Director of Emergency Medicine at St George's.
Lovely, thank you ever so much. So Paul, it would be really interesting to hear about how it was for you and how it was for your teams before you made the changes.
Yeah, I think one of the best things is that we all the three of us had all come from a slightly different background. So I'd been at St George's for 8 years and then had been recently promoted to Clinical Director. And then Tori had come from a different hospital and Matt had come from a different department who's working in acute medicine. So I think for me, what I'd seen is that it was becoming increasingly challenging, and I think this is not just true of St George's but other hospitals, other EDs, to meet the 4-hour standard and to provide patients with the level of safety and quality that we would all aim to achieve. Part of that was because our department, although it had some improvements to become a major trauma centre about 10 years ago, was now really struggling in terms of capacity for the patients that we needed to see. I think quite a problem had arisen in that many departments, including our own, particularly when working with some of our big teams that we refer to, have become quite siloed in their working. And that is something that is probably harder at St George's because we have so many subspecialties. And I think Tori, coming from a different hospital, had a sort of different perspective of what we could change. And so perhaps if I pass over to you, Tori, to talk about that.
Yeah. Okay, so it was really interesting to join St George's as a major trauma centre, big London hospital. I'd come from Western Sussex, which is very different in terms of population and size of hospital. But what I noticed was an inconsistency in the performance of the teams, not just in terms of the 4-hour standard, but also in terms of the interdepartmental relationships. As Paul says, there's lots of subspecialties. Being a tertiary centre for many specialties, there's lots and lots of different care pathways. There was also some inconsistency within the interprofessional relationships between the different staff groups as well, which made that sort of working across the care pathways quite disjointed at times, and certainly from the nursing perspective, the team were feeling quite disempowered in terms of leadership, operational and professional leadership. So it was a challenge. It was a challenging time to come into an organisation, and luckily we had ECIST booked to come in the September to come and do a review of where we were, and that was really helpful. And I don't know if Matt, you want to come into that because you joined us as well, but you were from the acute medicine side.
Yeah, I mean, I first got involved with ED, actually from the perspective of acute medicine. And I think one of my first reflections at the time was that there's very much a focus on looking at the numbers to decide whose fault it was that there'd been poor performance, as opposed to spending that time more productively on actually how can you work together. And one of the first things we did with Tori was actually when we set up the sort of 3 times a week meetings between ED and the acute medical unit, was actually to very clearly make those safety and performance issues, and it was from scheduled care as opposed to the ED target. And obviously the ED target falls out of the back of that, but I think it was very important the language that we used and the focus on how do we work together in a joint and positive way to actually improve the performance across the whole of the pathway rather than just focus on individual parts of it. And I think that's made quite a big difference. I think the other thing was that I think we're very much focused on positively seeing the best in each other across the departments, so that when there was a problem, it wasn't because somebody had been difficult or somebody had not tried hard. It was actually just understanding what the issue is and how do we work better to make sure that things improve in the future.
Yeah, absolutely. That's really interesting. And we know that a lot of organisations struggle with having joint meetings, that they become a blame meeting rather than a focused meeting on what we can improve and we can do better for our patients on this journey. So how did you sort of overcome some of those challenges when working with some of the specialties to get them engaged and involved in the work that, you know, obviously you were fronting?
I think if I just start on that, Helen, I think, and then others will come in, but I think one of the most important things is how we use data, and I think it's very much you use data as a starting point of inquiry, as opposed to something which you use to beat people with. So with the first cut of any data analysis we do is to actually see, is there anything that could have been done differently? Because a large percentage of breaches that you have are entirely appropriate clinically, or because something completely outside of your control has happened. So if you just remove all of those from the conversation, it means you're actually focusing on things where there's gains to be made. And I think by doing that, it's enabled us to focus on the areas of improvement rather than essentially going through lots of data which is never going to be of any real value because there's nothing that could have been done.
Yeah. And when so obviously you noticed that there was some improvement to be made and some barriers to almost break down within the organisation. How did you decide who or what or when was going to actually join these safety and performance meetings that you'd set up across the organisation? And I'll just ask that to Paul.
Yeah.
I think we decided early on, and I think we try and do this in everything we do actually, is that we have a structure which I imagine many trusts do actually, where we have medical, nursing and management representation. And so we thought it was really important, not just from our side in the ED, but also for our colleagues in other specialties, that we bring the whole team together, because the nursing perspective might be very different from the medical one. And I think we always talk as a three about the importance of language, and you need to be really careful about the terms you use. So Tori particularly chose the term unscheduled care, which Matt's already mentioned, as saying this is not ED, this is not acute medicine, this is about the whole team working together. And just small things like that helped create joint ownership of the situation, which has really driven us forward. And now the fact that, I mean, I think at the time we weren't even really having meetings together, or certainly not on any regular basis. And now we meet with the medical team 3 times a week, and it just means any issues that we've got can be addressed straight away. And following the success with acute medicine, we then rolled that out into surgery, radiology, pathology, all the specialties. So it's really been a success story.
And obviously all of these changes were happening during COVID. And how did you find implementing change during COVID? I think, Tori, you've expressed some views on that previously.
Yeah, I think we were able to, as a team, maximise on the opportunities it presented to us, and I think that's been one of our successes, is that we've not been afraid to fail and not been afraid to try things. And when we say meetings with specialties, it sort of has a connotation that it's a sort of a board meeting and there's lots of papers. It's more on a huddle type style meeting, so it's very much in action and dynamic, rather than making minutes and notes. And you know, occasionally we'll have an action log, but it's very dynamic. It's about owning what's there. We couldn't have done it without the divisional support that we had at the time with our DDO, our DDNG and our clinical chair as well, because they were able to help us across the organisation, perhaps if there were some challenges with other specialties in getting engagement. The perceived blame culture was a real challenge. We thought would be one of the biggest challenges to break down, but actually was one of the easiest. Once we got in a room face to face with people or on Teams, and the language that we used, once we were able to see that we were all here for the common goal, which was to ensure that the patients got the right care in the right place at the right time and had a good experience whilst they were at it, once everybody realised that was the focus, then it was actually very easy to have those conversations, and people then the perceived blame culture just melted away, the defensiveness melted away, and all of a sudden we went from a challenged interpersonal, interdepartmental relationship to people actively seeking to care about one another and care about the patient pathway and the patient flow in a much more dynamic and proactive way. It wasn't that people didn't care before, but we were being much more dynamic about it now, and it was having a much more positive impact for patients. But COVID was certainly a challenge that presented opportunities, and we took them.
Absolutely, and when we've had that reflection time, and I've reflected with yourselves and the team, it was really about actually, everyone was experiencing incredibly difficult and challenging times, but you absolutely grabbed that opportunity to make changes for the better, and that really has shown in the improvements that certainly as ECIST we've witnessed within the organisation and across the whole emergency care pathway. I guess really another question for me would be, what's next?
So I think in terms of grabbing those opportunities, I think that's something that we've really learnt from during this process. And obviously we were lucky enough to get some funding to refurbish our department, which is coming towards a conclusion now, but has meant we could increase our capacity significantly. The other thing that's helped us with our meetings has been the use of video conferencing. Really been an issue previously in emergency departments because of the 24-hour nature of the work, that getting people together in a room at the same time has been very, very challenging. So, video conferencing means that we can meet much easier, both internally within the ED and outside of ED with other specialties as well. So those are a couple of things that we want to continue to take forward, but perhaps something Matt might want to talk a bit more about. But it's this belief that the three of us have got, that we don't want to rest on our laurels, and we've proven what we've done so far, that sort of self-critique at looking, and again using language again, what we can do better rather than what we can blame each other about, but what we can do better next time, and looking at those marginal gains in how we can improve. So Matt may want to talk a little bit more about the detail of that.
Yeah, and the other thing I'd add to what you said, Paul, about the improvement works that the COVID capital monies gave us, is it was taken as an opportunity by the team to actually completely look at the pathways of those patients coming through the emergency department, how we process them, how we triage and how we get them to initial assessment, etc. And that was a process that was worked through by every member of the team, from the doctors, the nurses, the receptionists, the flow coordinators, etc. And I think that's made a huge difference, because it wasn't just a case of getting some money and putting in some new building works. It was actually, how do we make this better for the patients? And because the team was so involved themselves in actually designing that, rather than it being imposed on them, everybody's grabbed it enthusiastically and is making it work well. In terms of going forwards, I think it's important that we don't rest on our laurels, and I think we all know it's easy once you look at various different league tables, etc., as to where you sit, either in the region or nationally. It's there to be celebrated, but it doesn't mean anything in itself. It's an indication of how well we've improved the department and the care for the patients, because the numbers are only indicators of the care that the patients are getting. And I think it's really important in terms of how we work together that we don't get too focused on the numbers, or certainly you and Tori don't get too focused on the numbers, because it's the patient care that's the most important thing. But like I say, it's an indicator, and we just want to continue to improve every way that we get. So I think it's a question of, if we get 95% or plus in a day, that might not be a perfect day, because things might not have gone as well as they could have done. And then there's other days when we might get below the target number, but it's actually a brilliant reflection of the department has worked incredibly well that day in terms of dealing with the challenge that we've faced. And so I think it's keeping that focus on, are we doing as well as we can possibly be doing every single day? Are we working as a team, and are we taking the credit with others when there's credit to be had, and do they share the responsibility with us when there's problems to be faced?
Absolutely, and I think, you know, when
I
I've been
think that's
joining
a
the
really
teams through some of this process, we talk every time that I'm talking to the teams. It's about putting patient in the centre of everything that you're doing, and actually, if you do the right thing for the patient, the numbers will come out naturally, and that really has been evident in every conversation that I've had with the organisation and with you three, three leaders as well, and it clearly is driven from the top. And you know, I certainly didn't recognise the department after a visit in 2019 to coming back in 2020, and some of the conversations that we were having were showing that you've made such a monumental difference in a time when it was really difficult, but also it's something that's really difficult to make those improvements on when you're talking about relationships and cross-divisional working and putting the patients first and centre rather than target-driven performance. So, you know, it really is great to have that conversation with you guys today about the improvements that you've made, and really, really looking forward to obviously coming back and seeing St George's and other people as well. We would certainly signpost anybody that was asking about how to make these improvements to St George's. As an example of improved patient experience and journey, but also sustaining that. And I think sustaining it is actually the hardest bit, and especially when we're coming out of COVID and numbers are going up, and you're still managing to sustain that. So, you know, I just wondered if there was any final words from anybody today.
One thing I would say is that, and Tori alluded to it before, is the support that we got from the divisional team and from the chief operating officer, in that I think St George's as well has become quite a bit less reactionary, and so we've been given some space to make some improvements that are going to maybe take a few months to actually evolve, but having given us that time, we've been able to make those changes which have been really significant, rather than kind of automatically coming up saying we need a plan for tomorrow that's going to improve things. And out of that has flowed our meeting, such that we now have the trust of the organisation to review our own performance regularly, whilst having the time to make those changes. And I guess just the last thing from me is that we'll be delighted if anybody wants to come and visit us and show them that anything that we've learned. If we could share that to others, then we'd be more than welcome.
Thank you. Lovely. So I've just a massive appreciation for your time today and for sharing the journey that you've been on. And as Paul has alluded to, they're more than happy to be contacted for further discussion and some examples of the great work that's happened at St George's. So really appreciate it, and thank you very much.